You're walking across the room, getting up from your favorite chair, or reaching to kneel down in the garden, and suddenly you hear it. That familiar pop, crack, or click from your knees. If you're over 60, chances are you've heard it more than once. And maybe you've asked yourself, is this normal or is something wrong with my joints? The truth is, our knees carry us through so many moments in life, from dancing in our youth to steadying our steps as we age. They're strong, resilient, and designed to support us, but like all things that work hard, they eventually show signs of wear. And sometimes they make a little noise along the way, but not every sound is a reason to worry. In today's video, we're going to gently explore what those cracking or popping sounds actually mean when they're simply part of normal aging, and when they might be telling you it's time to pay closer attention. Because here at Senior Wellness, we believe that staying informed is the first step to staying strong, and that knowledge paired with self-care can keep you moving with confidence at any age. If you find this topic helpful, please like, subscribe, and share it with a friend who might need a little reassurance today. Let's walk through this together with wisdom, comfort, and clarity. That cracking sound in your knees. Is it something to worry about? If you've ever stood up from a chair or taken a few steps and heard a cracking, popping, or clicking sound in your knees, you're not alone. Many older adults experience this, sometimes daily, and it often leads to one big question. Is this normal, or is something wrong with my knees? The good news is that in many cases, these sounds, often described as creaking, snapping, or popping, are completely harmless. As we age, our joints go through changes. Cartilage may wear slightly, tendons may shift, and the fluid that helps lubricate your joints can move in ways that create sound. These sounds are known as crepitus, and they're actually quite common. In fact, hearing a bit of noise in your knees isn't necessarily a sign of damage. If there's no pain, no swelling, and no loss of mobility, then it's usually nothing to worry about. Think of it as your knees' way of saying, I've been working hard for decades. Sometimes I make a little noise now. This type of crepitus is often related to tiny bubbles in the synovial fluid, the natural lubricant in your joints, popping as your knees move. It can also happen when a tendon or ligament shifts slightly over bone. These movements are normal, especially after you've been sitting for a while, or if you're just starting to move again after rest. However, while the noise itself might not be harmful, it's always worth paying attention to the context. If the cracking or popping comes with pain, stiffness, swelling, or if your knee feels unstable, that's when it may be a sign of something more. In such cases, it could be related to arthritis, inflammation, or wear in the cartilage. We'll explore that more in the next section. For now, if your knees are making sounds, but you're moving comfortably and without discomfort, it's likely just a natural part of aging. Staying active, stretching gently, and doing light strengthening exercises can actually help reduce stiffness and support healthy joint movement. At the heart of senior wellness is learning to listen to your body with both curiosity and compassion. Not every sound or sensation is a signal of something serious. Sometimes it's just part of the beautiful, ongoing story of a life in motion. Still, if you're ever unsure, or if the noises start to come with discomfort or changes in function, speak with your doctor. You deserve peace of mind, and proactive care is a cornerstone of senior living. So the next time your knees speak up with a little pop or crack, smile. They're reminding you just how far they've carried you. And with care, they'll carry you even farther. When knee cracking is normal and nothing to worry about, it's a moment many older adults are familiar with. You stand up from a chair, take a few steps, and hear a quiet pop or crack from your knees. You pause and wonder, should I be concerned? The truth is, in many cases, the answer is no. Hearing popping or cracking sounds in your knees, especially when they're not accompanied by pain, swelling, or stiffness, is often a normal part of aging. This harmless noise is commonly known as crepitus, and while the name may sound serious, it usually isn't. So what causes this sound? One explanation is the movement of tiny air bubbles in the synovial fluid, the natural lubricant inside your joints. When you bend or straighten your knees, those bubbles can burst or shift, making a popping sound. It's similar to cracking your knuckles, more noticeable than it is harmful. Another common cause is ligaments or tendons moving slightly over bony surfaces as the joint moves. These tissues can stretch or shift just enough to create a subtle noise, especially if you've been sitting for a while or are changing positions quickly. This can happen more often as connective tissue becomes less elastic with age. Here are a few situations where cracking knees are considered normal. You hear popping when standing up after sitting, but there's no discomfort. Your knees crack during stretching or squatting, but you feel strong and stable. The sound is occasional, not constant, and doesn't interfere with your movement. There's no visible swelling, redness, or change in how the joint moves. In other words, if your knees are noisy but not painful and your range of motion feels normal, you likely don't need to worry. It's simply your body adjusting as it moves, and it's more common than you might think. That said, it's always good to keep an eye on your symptoms. If your knee starts to crack more often, or if the sounds are joined by aching weakness or instability, it may be time to check in with your doctor or a physical therapist. Here at Senior Wellness, we encourage a proactive but calm approach to aging. Our bodies naturally change over time, and some of those changes come with sound effects. What matters most is how you feel while moving, not just what you hear. In fact, many seniors who stay active through walking, stretching, or light strength training notice that the sounds become less noticeable as the muscles around their knees grow stronger. So next time you hear that little pop, smile. Your knees are still doing their job, and with care they can keep supporting you for years to come. And if you're ever unsure, remember checking in with your doctor is always one of the smartest senior health tips you can follow. When knee cracking may be a sign of joint wear or arthritis. While occasional cracking in your knees can be completely harmless, there are times when it's not something to ignore, especially if the sounds come with other changes in how your knees feel or move. If you notice that the popping or cracking is accompanied by pain, stiffness, or swelling, it may be a sign of joint wear or early stages of osteoarthritis, the most common form of arthritis in older adults. As we age, the cartilage that cushions the bones in our joints naturally begins to thin. When that protective layer wears down, bones may start to rub against each other. This friction can create sounds, but unlike harmless crepitus, it's often paired with discomfort, limited range of motion, or a feeling of instability. Here are a few signs that the cracking or popping in your knees may need medical attention. Pain that increases when walking, climbing stairs, or standing for long periods. Stiffness in the morning or after sitting for a while, especially in the front of the knee. Swelling or a feeling of warmth around the joint. Grinding or grating sensations when moving the knee. A feeling that the knee is giving out or unable to support your full weight. If these symptoms sound familiar, it's worth discussing them with your doctor. You may not need medication or surgery. Many seniors manage mild joint wear with gentle exercises, lifestyle changes, and self-care strategies. Understanding the difference between harmless noise and warning signs is key to protecting your mobility and independence. The earlier joint changes are identified, the more options you have for keeping your knees strong and supportive. One of the foundations of senior wellness is staying active even when your joints aren't perfect. In fact, controlled movement is often one of the best things you can do for your knees. Low-impact activities like walking, tai chi, cycling, or water aerobics help maintain flexibility and blood flow without putting too much strain on worn cartilage. In some cases, your healthcare provider may suggest simple imaging, like an X-ray to check the condition of the joint. They may also recommend physical therapy, joint-friendly exercises, or specific routines that focus on strengthening the muscles around the knee for better support. Just remember, knee arthritis doesn't have to mean giving up the activities you enjoy. With the right care and attention, many people live full, active lives, even with some degree of joint wear. So if your knees are making noise and they're also stiff, painful, or swollen, take it seriously, but don't be discouraged. Awareness is your ally, and taking action early can keep you moving longer and living well. That's what senior living is all about, finding ways to adapt, protect, and thrive at every stage. And that's the heart of senior wellness, listening to your body and making choices that support comfort, confidence, and quality of life. When muscle imbalances or joint misalignment cause knee noises, sometimes the cracking or popping sound in your knees isn't caused by arthritis or aging alone. It could be the result of muscle imbalances or even slight misalignment in the way your joints move. As we grow older, it's natural for some muscles to become weaker than others, especially if we've been favoring one side of the body due to past injuries, pain, or simply habit. When certain muscles around the knee, like those in the hips, thighs, or calves, lose strength or flexibility, they can pull unevenly on the knee joint. This uneven pull can make the joint move slightly out of its optimal path, leading to clicks, pops, or grinding sounds. It doesn't necessarily mean something is wrong, but it does mean your knees are working harder to compensate for a lack of balance. You might notice your knee makes more noise when walking uphill or getting out of a chair. One leg feels slightly stiffer or more awkward during movement. Your knees feel off track, like they're not bending or straightening smoothly. You tend to stand, sit, or walk with more weight on one side. These small shifts in posture and movement may go unnoticed at first, but over time they can affect the alignment of your kneecap, as well as the pressure distributed through the joint. When this happens, sounds like cracking or popping may become more frequent, not because something is damaged, but because the joint isn't moving as efficiently as it could. Another possible cause is a slight misalignment of the hips or pelvis, which is surprisingly common with age. Even a small shift in how your pelvis tilts can change the angle at which your knees bend and carry weight. The positive news: these issues are often very manageable and sometimes reversible through gentle strengthening, stretching, and body awareness exercises. Working with a physical therapist can help you identify where the imbalance is coming from and teach you how to correct it. Even simple exercises like leg raises, hip bridges, or quad strengthening can help bring more stability to the knee and reduce noise caused by misalignment. As always, if your knees are making new or louder sounds, especially if accompanied by pain or a feeling of weakness, it's a good idea to check in with your healthcare provider. At Senior Wellness, we believe in addressing these changes early, not because they're urgent, but because small shifts today can lead to greater comfort tomorrow. Your body has supported you for decades. With the right care, attention, and senior health tips, it can continue to support you with strength and grace in the years ahead. So if your knees are speaking up, listen with kindness. They may just be asking for balance and reminding you that it's never too late to restore it. When to see a doctor and what you should pay attention to. If your knees make the occasional sound without pain, you probably don't need to worry. But when those noises are accompanied by pain, swelling, stiffness, or weakness, it's time to take a closer look. As part of good senior wellness, knowing when to check in with a doctor is just as important as staying active or eating well. It's not about being alarmed, it's about staying informed and proactive. So how do you know it's time to talk to a healthcare professional? Here are a few signs to watch for persistent pain in or around the knee, especially during movement or at rest. Swelling that lasts more than a day or seems to come and go regularly. Morning stiffness that takes longer than 30 minutes to ease up. A feeling that your knee is unstable or that it might give out. Difficulty going up or down stairs or standing from a seated position. A grinding sensation or loud cracking sound that comes with discomfort. These signs could point to conditions such as osteoarthritis, meniscus wear, or even mild inflammation that's putting strain on your joint. Early detection can make a big difference in managing symptoms and preventing further progression. When you visit your doctor, they may perform a physical exam to check your range of motion, joint stability, and muscle strength. Depending on your symptoms, they may recommend imaging, like an X-ray or MRI, to better understand what's going on inside the knee. In some cases, you may be referred to a physical therapist who can assess your posture, gait, and alignment to see how your entire lower body is working together. Often what's felt in the knee actually starts in the hips back, or even the feet. But here's the encouraging part: even if you're dealing with mild arthritis or alignment issues, most cases don't require surgery. With the right stretches, gentle exercises, and lifestyle adjustments, many people see real improvement, often in just a few weeks. The most important thing is not to delay. Sometimes we ignore these signs out of fear that we'll hear bad news. But in reality, the earlier you act, the more options you have. And choosing to seek help is a powerful step in protecting your mobility and independence. That's what senior wellness is all about: being honest with your body, listening to its signals, and giving it the care it needs. You've trusted your knees to carry you through a lifetime of steps. Now they're asking for a bit of attention in return. And with the right care, guided by a few smart senior health tips, they can keep carrying you with strength, confidence, and grace. So if something doesn't feel quite right, don't ignore it. Ask, explore, care. Daily habits to support your knees. Simple steps that make a big difference. If your knees have been making more noise lately or feeling a little less reliable, the good news is that there are gentle, practical things you can do every day to support them. These aren't extreme workouts or complicated routines. They're small, intentional steps that help protect your knees, keep them flexible, and reduce discomfort over time. Let's start with one of the most important foundations of senior wellness movement. Contrary to popular belief, resting too much can actually make joint issues worse. Staying still for long periods causes the joints to stiffen, the muscles to weaken, and the surrounding tissues to tighten. Light, consistent movement keeps the knees lubricated and the muscles active. Try these simple daily habits. Gentle leg raises while sitting can help strengthen your thigh muscles, which support the knee joint. Hamstring stretches either lying down or while standing can improve flexibility and relieve tension behind the knee. Step-ups using a low step or stair build, both balance and strength. Just be sure to hold on to something stable for support. Even a short walk around your home or yard can make a big difference. The key is consistency, not intensity. A few minutes each hour is better than staying sedentary all day and then trying to make up for it later. In addition to movement, maintaining a healthy weight can greatly reduce the stress placed on your knees. Every extra pound adds more pressure to your knee joints with each step. Losing even a small amount of weight can ease pain and improve function. Another important part of knee support is being mindful of your posture. Slouching or leaning to one side can place uneven pressure on the knees and hips. Make a habit of standing evenly on both feet and sitting with your knees aligned and relaxed. Proper footwear also matters more than we think. Shoes with good cushioning and arch support can absorb shock and keep your knees in better alignment. Avoid worn-out shoes or those without proper grip, especially on slippery floors. And finally, nourishing your joints from the inside is just as important as moving them. Stay hydrated. Eat a diet rich in anti-inflammatory foods, like berries, leafy greens, and omega-3 fatty acids. And speak to your doctor about supplements that may support joint health, such as glucosamine or collagen, if appropriate for your needs. At its heart, senior living isn't about doing everything perfectly. It's about doing what you can when you can with care and consistency. Every small choice, a gentle stretch, a better shoe, a short walk, is a quiet act of self-respect. And over time, those choices add up to stronger knees, better mobility, and greater confidence. Because here at Senior Wellness, we believe aging well doesn't require perfection, just attention, kindness, and a little bit of movement every single day. Your knees have carried you through a lifetime of moments, the long walks, the quick steps, the quiet stillness, and everything in between. So if they're starting to speak up with a little crack or pop, know this: it's not the sound of weakness. It's the voice of experience. It's your body gently reminding you to pay attention to care and to move with intention. Not every sound is a warning, but every sound is worth listening to. Whether your knees are strong and steady or asking for a little extra care, you have the power to support them through movement awareness and daily habits that honor where you are now. At Senior Wellness, we believe aging isn't about what you've lost. It's about what you can still build: strength, balance, and confidence one step at a time. If this video helped you, please like, share, and subscribe to stay connected. We're here to walk this journey with you with understanding, support, and gentle encouragement.